Mary Seacole, Florence Nightingale and Edith Cavell were all women and nurses who helped care for sick and injured people. Mary Seacole was a nurse from Jamaica who travelled to Crimea to care for soldiers during the war. Mary Seacole faced many challenges because of the colour of her skin. Mary Seacole set up the British Hotel to care for soldiers. She was known for her kindness and called Mother of the Army.
Why are these nurses significant in history?
Mary Seacole, Florence Nightingale and Edith Cavell lived during a time when medical equipment was still in early stages and were limited. They were able to introduce new ways to care for soldiers, like new methods to track a patient's outcome, which are still in use now today. Edith Cavell was a nurse from England who helped care for soldiers during World War I. She was also known for helping soldiers escape from their enemies, which was a very dangerous thing to do. Florence Nightingale found the hospitals in Crimea dirty and disgusting. Florence Nightingale improved hygiene in the hospitals by introducing clean bedding and cleanliness overall. This helped stop the spread of disease. Florence Nightingale also improved the care of patients.
What changes did these nurses make for the future?
These nurses made important changes for the future by setting an example of bravery and dedication. They showed what can be accomplished when we are willing to help others. Their work helped improve medical care. All three nurses are remembered as heroes.